You know, for so many years, addiction was really not looked at as a medical illness. I have always believed that it's a medical illness and that it's a chronic medical illness, that it has signs and symptoms, that you can diagnose this disease, and there are certain testing modalities to help tell you what's really going on with a particular patient. And probably the most important and most objective testing we do is drug testing. And U.S. drug testing laboratories, in our minds, is the premier laboratory in the country for doing the specialized type of testing that we have to do on individuals such as physicians and dentists and other types of high-functioning professionals. If you look at the Department of Transportation and kind of the typical drug testing programs for long-haul truckers, airline personnel, those sorts of individuals, the testing is typically for a very narrow group of drugs. We have patients who literally have access to everything, legal and illegal, in unlimited quantities. And to do top-level drug testing requires a partner such as USDTL who understands our needs and understands the type of situations our patients get into. So USDTL has been really at the forefront of hair testing, nail testing, testing for alcohol metabolites, testing for synthetic narcotics and sedatives that most labs just don't have the ability to, or even the interest in developing those type of tests, because the market for that kind of type of testing is much more narrow than the broader testing world for like the Department of Transportation and typical employers. And so they really are leading the way in terms of markers for alcohol use. Alcohol is our probably biggest risk of relapse drug, regardless of what drug the patient was really using that got them into trouble, because it's legal, it's widely available, it's inexpensive, and it is rapidly eliminated from the body. So the ability to test for metabolites of alcohol in urine that can pick up alcohol metabolites for 2 or 3 days, whereas a typical blood or urine alcohol test is hours in terms of level of duration of detection. The ability to test for those things in hair and fingernails and toenails gives us a much longer window for significant use. There is the phosphatidylethanol blood test, which allows us to have a high degree of accuracy and comfort that we can look back up to 3 weeks. So it's this type of cutting-edge leadership that makes USDTL a perfect partner for us, and I really believe the laboratory of choice for particularly the populations that we and other individuals like our type of practice serve.